Great. So good evening. Thank you for being here tonight. My name is Pedro Arciniega with the Family Advocate Program, and I am the Outreach and Engagement Coordinator for the Family Advocate Program. Um, it is our belief that an informed family member makes a better caregiver. We have a three-pronged approach to our services, this being one of them, education and empowering families to be better caregivers. Um, for tonight's presentation, we hope to educate, not we, our experts here tonight, who we're very happy to have here. Some misconceptions, worries, and myths about Narcan, as a lot of our loved ones do may practice self-medicating behavior. It is always, and not just for self-medicating, it could be anything. And Dr. Weigold and Dr. Mitchell and Dr. Khan, who is here tonight, will let us know more about that. We're very fortunate to continue to collaborate with presenters, both from our agency and outside experts. Everybody who is presenting here tonight is from within our agency at Riverside University Health System. Tonight, we have several expert viewpoints for our discussion about Narcan. We have tonight Dr. Mitchell, who is a graduate from the University of Texas, and she got a bachelor's degree in chemistry, followed by a pharmacology degree from the University of Pacific Thomas Long School of Pharmacy and Health Sciences. She completed her residency program in New York, Harvard VA Medical Center in New York, before completing her residency at the VA in San Diego. Following her residency, she joined the faculty of Long Island University in Brooklyn, New York, where she taught didactically as a well-managed Codeman clinic, rounded on mental health floor and geriatric floor, all while precepting all years of pharmacy students. She now practices at Riverside University Health System. We're very fortunate to have her as a senior clinical pharmacist, where she has worked with the county's mentally ill for over 10 years, both at the medical center and mental health facility. She is a residency program director for the psychiatric pharmacy residency program. Additionally, she precepts students from a variety of colleges for their first and second year residency. We also have Dr. Khan, who works in the substance abuse program with medical assistant treatment, and he'll be answering here some questions and answers. And Dr. Weigold, who some of you know before, began working, because he's done our presentations, began working in behavioral health back in 1986. I'm pretty sure that way back when they all had to work with rocks and sticks. He has worked in 4 different states and 3 different counties in California, which makes me wonder if he's really just trying to stay one step ahead of the law. He has worked in Riverside County now since 2007 in ETS and ITF and several different clinics. And at one point, he was the only psychiatrist for 4 different clinics at the same time. Yup, you see, he's still just trying to move faster so that fast enough that he won't get in trouble. So that's our presenters for tonight. We are going to do 2 sets of presentations, one from our psychiatrist viewpoint and one from our pharmacist. We'll do the presentation and then we'll open it up for Q&A for that, and then we'll go into the second part. And at the end, we are going to do a round robin, all-inclusive questions and answers. With that, I'm going to leave the floor open for Dr. Weigold.
Well, thank you. If at any point you can't hear me, please give me one of these and I'll see your hand go up and know that you can't hear me anymore. Until then, I'll just keep talking. Let me see if I can share the screen here. And I'm hoping you can see that I'm starting a slideshow.
Yes, we can.
All right, and you see the one big slide about Narcan, correct?
Yes.
Okay, so here's what I'm going to be talking about tonight. What is Narcan, otherwise known as naloxone? What does Narcan do? Why is Narcan the medication for opioid overdoses? And why you should have Narcan if you or a loved one has opioid chemicals around for any reason at all. So, real quick, all medicines have a brand name and a generic name, but it is precisely the same medication. They're not just similar, they are in fact the same. Tylenol is a brand name for acetaminophen, and 325 milligrams of acetaminophen sold anywhere in the US from any manufacturer is precisely the same as 325 milligrams of brand name Tylenol. So I just want to make that clear so that you can understand that Narcan is simply a brand name for the chemical naloxone. So what is Narcan? It blocks the effects of opioid chemicals, especially in a potentially deadly overdose. And it doesn't matter what the reason is that somebody has taken too much of these opioid chemicals. It doesn't matter if they're prescribed. It doesn't matter if they're being used legally or illegally or recreationally or even by mistake. If it's an opioid overdose, Narcan can block that. So what are opioids? Well, they're a whole variety of chemicals that are based on the same active ingredient from one particular poppy plant. The ingredient is opium, and that's why they're called opioids. These medicines can all reduce pain. They can produce the feeling of euphoria, an intensely pleasant and relaxed feeling, and they can all produce addiction. The opioid chemicals include the list you see here: opium, morphine, heroin, Vicodin, and you'll notice that fentanyl is bolded because I want to talk a little bit more about that later. But I also want to mention that the combination pain medicines, Vicodin, Norco, Tylenol 3, Darvocet, Percocet, these are all mixtures of an opioid chemical and also a non-opioid pain medication like acetaminophen or ibuprofen. But these have active opioid in them and can easily produce an opioid overdose. Narcan blocks the effects of any of these. It doesn't matter which one is causing the overdose, Narcan can block it. So there are lots of other addictive chemicals that are not opioids. Naloxone, Narcan will not have any effect on an overdose of these other medications. Some people use the word narcotic to mean opioid. Whoops, sorry. But the word narcotic really just means that there are legal restrictions on the use of this particular chemical. The word narcotic does not necessarily mean opioid, but you'll hear a lot of people use them as if they mean exactly the same thing. So let's talk about specific myths. The myth that having Narcan will actually encourage people to take more drugs. Well, of course, the fact is Narcan does not encourage people to use more drugs. Does having a fire extinguisher cause people to set fires? Well, guess what? No. Does learning CPR cause more people to drown? No, you already knew that. Having a plan and a method for managing if things go wrong does not actually cause people to do it. Does calling the police during a robbery cause robberies? No. This is the slideshow is getting away from me a little bit. So if there's Narcan available, will addicts fail to seek treatment? And the answer here is that Narcan, naloxone, increases the chance for overdose victims to seek treatment because they are still alive. I know it sounds ridiculous to say this, but dead people don't seek treatment. If the person dies from this overdose, all of the options for treatment, all the options to help them are gone. Having a way to save their life will not reduce their chances of getting treatment. Saving their life makes it possible. The next myth, that Narcan is not effective for treating fentanyl overdoses. I told you I'm going to talk a little bit more about fentanyl, but Narcan is safe and effective for reversing fentanyl overdoses. Fentanyl and carfentanil are two very, very strong opioid chemicals. Fentanyl is sometimes prescribed in patches, but it's sometimes used by addicts in other forms. And sometimes dealers mix fentanyl into other drugs that they're putting up for sale. And sometimes they don't tell the users that there's fentanyl mixed in. Recently, in just the last few years, we've had a bunch of fentanyl overdoses from people who had no idea that they were using fentanyl. Again, naloxone, the myth is that it's not effective for treating fentanyl overdoses. And I wanted to show you just a couple of pictures of what fentanyl patches can look like, because many of you may have never come across this, but they're in these little packets. The patch itself is clear, and this is what it may look like on the skin, just so you have a clue, so you know what I'm talking about. Now, when you're comparing heroin to fentanyl to carfentanil, the amount of heroin somebody might use is the amount there at the bottom of that little bottle, circled in red. The amount of fentanyl that will produce the same effect is just these little chips at the bottom of the bottle. You'll see that's much less than the amount of heroin to produce the same effect. And for carfentanil, it's even dramatically smaller. This is an equivalent dose of carfentanil, and I've magnified it here just so you can see. It is just that one little chip. That is an equivalent dose to the same amount of heroin it takes to fill the whole bottle, the whole bottom of the bottle of heroin. Okay, I just wanted you to have a clue how these things compare. The next myth is that naloxone, Narcan, is unnecessary. Some people think that overdoses can be reversed by putting ice down the person's pants, or injecting them with salt water, or injecting them with milk. It is not true. Those things do not work. The fact is, naloxone, Narcan, and/or rescue breathing until EMS arrives are the only safe and effective methods for treating an opioid overdose. The next myth I want to cover is I can only get naloxone if I have a prescription from a doctor. The fact is, any person who asks a pharmacist for naloxone, Narcan, for themselves or for someone else, will be allowed to purchase the Narcan with or without a prescription. Now, that doesn't necessarily mean that insurance will cover it, or that it will be free, or even that the pharmacy is stocked with Narcan. So it's certainly smart to call ahead and make sure. Dr. Mitchell's going to give you a bunch of information about exactly how to obtain and use the Narcan through the laws here in California. The next myth is that only addicts can overdose. In fact, anyone who has opioid chemicals around could overdose. It's not at all unusual for someone who takes prescribed opioid painkillers to accidentally overdose. People simply forget whether they've already taken a dose. People sometimes use more than they were supposed to because they don't understand, or the pain was so severe. And sometimes people take one dose without any intent to take more, but then they get kind of loopy from that opioid pain medicine. and it causes them to forget and take more. And that's very probably what happened to me. I'm serious about this. Many years ago, I had a knee injury and I would never take the pain medications during the workday, but I got home and it was just throbbing. And I took, in this case, it was Vicodin. I was in for the evening, and about halfway through my meal, I fell asleep right into my food. About 30, 45 minutes later, I woke up, had no idea why I was covered in my dinner. And my best guess is that I took one and 10, 15 minutes later started my dinner, thinking I need to have food in my stomach when I have this medication, but that it made me a little bit foggy. And partway through my meal, I forgot that I'd already taken it and I took another one. Now, I was fine. I woke up and everything was okay. I certainly scared my wife, but I got lucky. And nowadays, I don't take those chances. If I'm going to take one for some strange reason, I take it out, put it aside, and I put the bottle away. But I want to make it clear, anyone who has opioid chemicals around or a loved one with opioids, should be prepared to save a life. This is easy, and it's absolutely worth having it around. Okay, so let's talk a little bit about what it is that Narcan does. In the brain, all of your nerve cells are linked up with other nerve cells at these little gaps. The gap we call a synapse, but don't worry, there's not a test later. But there are literally millions and millions and millions of these connections in your brain. And taking a look at a magnified view or a cartoon of this, we have the neurotransmitter molecules being expelled from one nerve cell into this gap, and then they land on the other side of the gap on receptors that are on that second nerve cell. They activate those receptors, and then the signal travels merrily on down the next nerve cell until the signal reaches another one of these gaps. So what happens when the neurotransmitter chemicals are these natural opioids, what we call enkephalins and endorphins? Many of you may have heard the term endorphins in regards to things like what they sometimes call a runner's high. That is when somebody's exercising heavily and their sensation changes from being one of exertion and pain to being one of very relaxed and enjoying the feeling. These microscopic, minute amounts of these natural opioids are flowing across this gap. That then reduces pain. And these are part of our body for that exact reason. So when a pain signal comes down the nerve cell, it causes these endorphins and enkephalins to come out into this gap and land on the receptors on the other side. So an even larger view, we have a pain signal coming down that nerve cell. The enkephalins and endorphins begin to fill up this gap and excite the receptors on the other side. And that reduces pain. But these are, like I said, tiny, tiny amounts of a few molecules of these neurotransmitter chemicals. So what happens if instead we fill the gap with opioid chemicals that we've put into the body in some other way? Injecting, snorting, inhaling, heroin, Norco, fentanyl. Well, now those molecules fill up this gap completely, excite all of those receptors, and not only do you have no pain at all, but it produces this sense of euphoria. And remember, we said euphoria is this intense feeling of pleasure and relaxation. And so people will start to get faces that look like this from that intense euphoria. So again, we have this gap between nerve cells filled up with the opioid chemicals. But now what happens when we bring in the Narcan? Well, when you give a dose of Narcan, then the Narcan molecules come in and block exactly those receptors. They block them completely. None of the opioid chemicals, whether natural or from the outside, can get to any of those receptors. And this is what reverses the opioid overdose. This is how you block those receptors, and the opioid effects are blocked. But the clock is ticking. You need to think about the fact that this is not forever. Narcan doesn't last forever. Depending on the person and the dose and the type of chemical they used, you have somewhere between 30 and 90 minutes before the Narcan stops working. Now I want you to think about what that means. You've just reversed a potentially deadly overdose. You need to call 911 because the Narcan doesn't last forever and you're about to be in trouble again very quickly. Because when the Narcan starts to go away, then those Narcan molecules that blocked all those receptors leave. And you're left with only those opioid effects that were endangering your loved one already. So please think about Narcan as a stopgap. You use the Narcan and you call 911. Okay. This is why you should have Narcan. If you or a loved one has opioid chemicals for any reason at all. All right. That's all for me. Now on with the show. Any questions at all about what I've been saying, about anything you need me to go back to? Anything in particular before we go on to hear from Dr. Mitchell?
I have a quick question, if you could.
Dr. Weigold?
Go ahead, Refugio.
I had a question. So I work in a field where, and in a city where opioid abuse is very heavily. So I'm trying to educate myself on, if and when that ever came, and I want to be there and be that that opportunity to help someone out. My question is using Narcan on somebody, are we covered just like anybody would be when it comes to supporting somebody with CPR? I think it's called the can't remember the right name, but just like somebody, if you help a stranger, are we protected for bringing them back as far as legal rights?
Good Samaritan Law.
Yes, the Good Samaritan Law, correct.
So I've got a few other people here who can probably answer that even better than me. Maria, it looked like you wanted to speak.
I was going to say Samaritan Law. Yeah, thank you.
Right, Good Samaritan laws. Dr. Mitchell, are you going to be talking a little bit about that?
I'm not going to be touching on that per se, but from my understanding, yeah, this is exactly the same of if you have it at your site. So I'm gonna speak a little bit more about the actual use of and like how to use the product per se. I'll show you with, I have like a practice device. But if you have it like with it, some of the churches will have it, or a clinic has it, and you've been trained on using it and you use it, first and foremost, it really shouldn't hurt the person. As long as they don't have an allergy to naloxone, if you use it and call 911, they can have some mild side effects, but we don't expect anything major to happen to them.
Okay.
So it's just exactly like what you were mentioning. If I give CPR out of the goodness of my heart to try to help save this person, is there legal ramifications? From my understanding, they're not going to be able to come after you for using naloxone if you've had some education on utilization.
And then I know you mentioned that this specifically is for opioid overdoses. If it was to be used on somebody that just specifically wasn't an opioid, can that hurt the individual, or it just wouldn't be effective?
It won't hurt them. And in fact, since you're going to use it and then immediately call 911, the 911 operator is going to ask you about this. And if you tell them, well, look, I gave the Narcan, I followed the instructions on the canister, I gave Narcan, and it had no effect. You've just given the EMS system vital information about what is going on. They now know that there's a very low chance this is actually an opioid overdose.
Okay.
And that it was probably something else. So you've actually saved the ambulance crew a bunch of time figuring this out on their own. So absolutely, if there's somebody down, I have no question about using the Narcan, and that's the result of using the Narcan is diagnostic information itself.
Okay. I appreciate the information.
Excellent question.
And I can just add on to Dr. Weigold's response. I guess your question was also that will it be effective if a patient has taken anything else or other things? Yes, it will not be effective. As Dr. Weigold very well said, that it has a diagnostic power that if patient has a opioid overdose, yes, it will show its effect. But if patient has taken something else, it won't be very much effective. Thank you.
Both of those questions are excellent, and I'm going to update my presentation with both of those.
And we'll have an opportunity to do more questions and answers at the end. So now we're going to introduce Dr. Mitchell, who is going to be talking about the pharmaceutical aspect of Narcan, how to get it and how to go about that. With that, Dr. Mitchell.
Perfect. So before I even get started, I pulled this up while we were in the, oh, I got to share my screen. Let me share my screen first. Oh. I want to share. Okay. All right. So I do want to just go over, before I go into the med, these are some of the things that you're going to be looking for if you weren't positive that somebody was had their opiates and that they were at overdose. So as we talk about the naloxone and the different naloxone products, this might be a quick little clue for you. Like you said, could it be somebody that you know that has diabetes? And that might be that they're having hypoglycemia. We might see some of the same symptoms where they might still be not moving. But then other things we will be seeing if they do have an overdose. So the pupils, the skin being cold and clammy, if they have something near them, a needle by them or a pill, then that might also help you. But I thought before I get started, it's a good little reminder. All right, so let's start with, okay, now we've learned about what naloxone does, but how would we get naloxone? So we're going to determine how to obtain it. We'll describe the different types of naloxone because we've been talking about Narcan specifically, and I'll go over that one in a little bit more detail. But there are some other products available, and based on price range, you may decide to keep one or another in your house or for ease of use. We'll discuss how to use naloxone, and we'll then understand how to store it. So several years ago, the state of California did put forth a bill 714 that prescribers must offer naloxone or a similar drug if you were on 90 or more morphine milligram equivalents per day, if you've been on a prescribed opioid plus a benzodiazepine, or if you were at an increased risk of opioid overdose based on that prescription for an opioid, they are to offer you naloxone, with exceptions of being terminally ill and administered within a facility. So if you or your loved one are somebody who's on daily opioids, and especially if they're high dose or they're on something, a benzodiazepine in combination, make sure when they're seeing their physician, they're going ahead, or their prescriber, that they're getting that prescription for the naloxone. So just a reminder, the opioids we said were things like, it could be Norco, it could be morphine, but it could be a whole host of products. And the benzodiazepines, this ones are like your Xanax, your Valium, Ativan, Librium. Those would be some of the products that in combination put the person at risk for having them, having some respiratory depression. So they could either have fall down and be kind of out of it, or having some issues breathing. And so we do definitely want to make sure that they have that product. Now, that doesn't qualify for everybody. So what if you need naloxone and you don't fall into one of those categories where your physician necessarily offered it to you, or you live with somebody who has chronic pain condition, or is having some other issues that they're on opioids? There are some ways that you can get the naloxone without a prescription. So depending on the pharmacy, like Dr. Weigold mentioned, they may have this as an example. Now, for the pharmacist to be able to give you this, give you the naloxone, they do need to be trained. It's really easy, but they do need to have been trained in utilization of the naloxone. You, as the purchaser, also will need to be trained on how to use the product. And like I mentioned, not all pharmacies participate, but all RUHS pharmacies, so that's the pharmacy either at the Arlington campus in Riverside, at Neighborhood. We have a pharmacy in Corona. We have 2 pharmacies at the main medical center, one in our new building and one in the hospital proper. All do carry naloxone. Now, the reason I mentioned cash or ran through insurance, depending on who your provider is, some of them allow us to prescribe it, for the pharmacist to prescribe it and run it through the insurance. Some other providers of insurance do not, so you may be required to pay for cash for it. And as we go through the products, I'll mention what some of them cost based on kind of some of the other meds. It may determine which one you're going to actually purchase then. So if you were going to get it from a pharmacist, it's really quick. They're only going to ask you a couple quick questions. They're going to ask you, do you have a history of using illicit or prescription drugs, or to someone you love? And if you say yes to either of those questions, they're going to ask you one more question, is, are you allergic? Are you the person who is on opioids and allergic to naloxone? Then you're not a candidate. If the person that we're getting it for is our loved one and they're allergic to naloxone, then they're not a candidate either. We'll have to come up with some other alternatives, but pretty straight and easy. Are they allergic? If not, if you're using it or your loved one's using it, you can go home that day with some naloxone. All right, so here I'm going to show you that there's 4 different types of naloxone. Number A is this multi-step nasal device. It's actually a little bit more cumbersome to use. The one that we all refer to, I have a little dummy product here. So it looks like this. This is the Narcan, the single step. Put up your nose, squeeze it quick. You can get the intermuscular injection. We use that typically in our emergency rooms. Or the Autoinjector, which is called Aveo, which is pretty cool because it actually talks to you, but it is very expensive. All right, so we'll talk about how to use each product. So you can see here, the nasal that is not the Narcan does come in a couple of different pieces that you do have to pull together. You have to pull off the yellow components, you have to put on the white cone, you have to put the product in it, and then we're going to do it up the patient's nose. No matter what, all of the products are going to be, we're going to use it in one nostril, or if we inject them in their leg, we're going to wait 2 to 3 minutes. We're going to call 911. We're going to wait 2 to 3 minutes. And then if they're still not doing well, this comes in a 2-pack. You can use it in the other nostril. So as we come upon a person who we think might be having an opioid overdose, we're going to do just like regular CPR. Hey, are you okay? Are you okay? Okay, no. If you see somebody, that's when they're going to call 911. Otherwise, you'll get the naloxone, and then you yourself will call 911. After you give it, you do want to try to roll the person on over to their side. If for any reason they do start to withdraw from the opioid and vomit, or just get nauseous and vomit from the product itself, we do want to make sure that they don't choke on that.
Dr. Mitchell?
Yes.
If you're trying to put up different screens, I don't think any of us are seeing it. It still shows signs of overdose.
Uh-oh. Okay. Hold on. Thank you. From the beginning. Okay. I'll go back to so here we go. You heard about those. That's not as important. These are the 4 types. So you can see the nasal spray. This is going to be this one here. So we'll take off the yellow components at the bottom, at the end. We'll put the white cone on. And this is going to be a nasal just like the Narcan is. So this, again, is kind of what we just described about the Narcan. So the product's really easy. You can see you're going to put your fingers here. This is just how you push up the device. Really easy, goes right in. And this just goes in their nose. As your fingers touch the top of their nose, that's how you know that you got it in well. And then you'll just put the spray back. If possible, you do want them on their back with their head tilted up so that that medication actually goes down in there. If we're face down, then all the medication is going to come out. So we do want them tilted back so the medication gets within them. You do want to roll them on over their side. As we call 911, we're going to kind of give or take 2 or 3 minutes. When we're in this kind of scenario, it's not going to be perfect. We don't expect anybody to be perfect in this kind of scenario. But again, the box will have 2. You can use the second one on the other nostril if you need to. Okay. There we go. Now, Avzeo is the next product, and so this one is an auto-injector. So it's going to go ahead. You're going to use this one on the outside of their leg. You do not need to take their pants off unless you kind of feel like, for us, we don't usually get it too cold, but if you have somebody with a bunch of layers on, you're going to need to pull some of those back so it does actually get into the person. But it actually lets you know you pull this down. And again, if you need to, you can do that second one. So some of the adverse effects can be similar to opioid withdrawal in those who abuse opioids. We can have some changes in blood pressure, some changes in heart rate. But again, we've called 911, so they're going to come and check right away. They might have some headache. For the nasal formulations, we are putting it up their nose, so we can have some nasal irritation or some nasal congestion, and that would be normal. Your auto-injection, you might have an injection site reaction. They might actually see where you gave it to them on their leg. As far as storage goes, it's pretty easy. So this is a room temperature, so you do not want to ever keep this in the fridge. Most of the time, we think it's more concerning to get something too hot. A lot of times with medication, getting it colder than we want it to is when we have to start destroying stuff. So it cannot drop below 59 degrees. So that's why we do not want to keep it in the refrigerator. The 68 to 77 is typical room temperature. But you're allowed to have some excursions up to 104 degrees. So in the summer, you have it out with you as you go, you're taking your family on a trip or whatever, and your auntie is on opioids and you have it with you. It's okay for a short period of time for it to go up to 104 degrees. They are protected from light. They all are going to be stored in those packages and boxes. So just keep it in there. You don't want to take the device out and keep it like this, because then this gets all clogged, all of that. Keep it all covered up, and you can take the whole thing with you. And then we do want to watch the expiration date, because it typically is 2 to 3 years from the time you get it. Oh, as I mentioned, my apologies, I promised this. So as far as prices go, if you were to pay cash for the medications and not run it through your insurance, Narcan, one set of Narcan will run you approximately $130 to $150. The Avzeo is much more expensive. It's about $250 to $300, depending on the pharmacy you go to. So it's best if we can get a prescription and run it through the insurance, or even if you're going to see the pharmacist, if they can run it through your insurance to get those co-pays down. But worst case scenario, you can always pay cash. Now, if you are here from any of these, the naloxone distribution project offered by SAMHSA can provide Narcan for specific groups. And those groups include first responders, but also religious entities, libraries, universities, homeless programs. And for the most part, they're for your program proper. So it would be held if it was at the library. I could think of the library in Riverside by the 7-Eleven. That's probably a great place to have some Narcan, because a lot of the homeless kind of go in there. Possibly some people, they go over and use by the 7-Eleven, then go back into the library. Would be a great place to have some, just in case you run into any of the scenarios. Now, the library would not then hand it over to the client and say, here's the product for you to take home. It's for the use there in case anything happens. There are some exceptions to that for some of the different groups. For instance, emergency rooms can order Narcan. And there is a minimum amount and there is a maximum amount that any of these specific groups can get from SAMHSA. So that is in summary. I'm going to stop sharing. And that is a little bit of summary of how you can go about getting the product. And then if you were to get the product, how could you use the product? Really, really easy. I would say this is probably one of the easiest things. Even with a lot of nasal devices, I can say that it's not hard to push. Sometimes you get a nasal device and it's like, oh, I really got to shove it up there and shove the device to get it to work. And that shouldn't be the case. This should be an easy thing for you to help somebody utilize.
I had a question.
Mm-hmm.
How would we know if someone's allergic to it if they've never used it before?
You wouldn't. It would be just like any of our other medications. Yeah. But remember, the main thing is we're always going to call 911. So is there a risk? There's a risk with anything. But I think that the risk, the benefits far outweigh the risk on this one. And you've already called 911 and they should already be on their way. So if anything did happen, they should be able to come out and help the person.
Okay, thank you. And the other thing is, you're mentioning insurance. I assume that would have to be the patient's own insurance and not mine as a loved one, right?
Correct. Uh-huh.
My insurance won't give me Narcan for somebody else.
No, I expect that to occur, yeah. But there may be agencies that you're working with who do have the product available, like I mentioned, some emergency services, but some clinics and the like do have enough to be able to give out to people. They just, if they're working with SAMHSA.
Okay, thank you.
I have a question. Do emergency services like ETS and do they have Narcan to give out if somebody were to go in and?
ETS proper does not. I'm not sure about the medical center. I will be really honest. ETS typically doesn't see a lot of the overdoses specifically for heroin. Yeah. Typically, they're going to the main medical center.
But they would,
yeah,
over there if they go to like the emergency room or something. That would be something.
And like I said, the pharmacy has the prescriptions, has the medication. Mm-hmm.
Thank you.
Mm-hmm.
But you know, ETS having one or two kits of Narcan around is not a half bad idea.
Yeah. Because I know our clinics, I mean, we have our clinic in Corona, we have, you know, Narcan there. So it's a behavioral health clinic, but we do have a substance abuse program within there. But I mean, I think maybe that's something to to talk about with RUHS. Mm-hmm.
We do have naloxone for somebody who comes. We don't have it to send home with them.
I see.
So all
Oh,
of our
okay. I
units,
guess that's what I meant. Mhm.
yeah, all of our units, every place, every unit within Arlington campus, even the new Unit G, all of them have naloxone on it, and it's on override. So if something happens, it's considered to us equivalent to aspirin or nitrostat.
Gotcha.
Right, so any same type of an emergency.
Now, I do want to take just a moment to mention, sometimes the overdose victim has paid a lot of money for the drugs on which they overdosed. And when you ruin that for them, because you realize they were about to die, but they don't know that because they were unconscious. So now when they wake up, you've just ruined their high and wasted a bunch of money. So for me, if I ever have the opportunity to use Narcan, I'm going to give the dose and then step away, because sometimes they're really angry about that.
I have a question. What should you expect to be the reaction time, and how long should you wait? I know it's effective, but if the first dose doesn't work, can you administer a second? And what was the time frame, or what you should be looking for before administering a second dosage, if that's the case?
So again, we want to wait that 2 to 3 minutes before doing the second dose. That would be the soonest you'd want to do the second dose, and you'd want to do it in the other nostril. But it would be the same kind of symptoms. So Dr. Weigold showed a really good example of how much heroin you need and how much fentanyl. And as fentanyl gets dispersed into a lot more of the products that's going out into the community, the risk is to have like a severe the overdose being much more significant. And so they may require more than one dose of naloxone. And so if you've given it once and you're pretty sure it's an opioid overdose, and really you haven't seen much of a change, if any change at all, in that first 2 to 3 minutes, it's okay to give the second dose at that time. Okay, so we would give the dose, we came back and they're still totally out of it, but I can see the needle and I know them and I know what they utilize. I would call 911, give those 2 to 3 minutes, and then up the other nose.
While I'm thinking about it, I'll mention one other thing. I gave kind of a long list of opioids, but I forgot to include on that the over-the-counter medication called Imodium. It's a medication for diarrhea, and you have to, in order for it to produce an opioid overdose, you would have to use a massive amount. But a few years ago, I had a patient who took somewhere in the range of 90 pills of the diarrhea medication, and he lived through it, but he was unconscious for about 12 to 14 hours. And as a result, he ended up in the emergency room for a whole different kind of medical problem, because the muscles that were against the ground had started to dissolve themselves. And he ended up in the ICU for several days as a result of this. But yes, his mother found boxes and boxes and boxes of Imodium, and we finally figured out that's what he took.
I have a comment. Dr. Weigold, thank you for sharing your experience with the pain medication. I think a lot of times we forget what we take, we forget what we take. So thank you for sharing your story. That was wonderful. I also wanted to make another comment. I don't think there's enough information on the benzos and what it can do. Not too long ago, I saw Dr. Oz show on the benzos with I forgot the name of the reporter, and I was floored. I'm like, why aren't more people learning about this?
Yeah, the benzodiazepines, the Xanax, Ativan, these medications are out there, not only prescribed to patients, but there's a lot of it on the street. Much of it has been diverted from original prescriptions, but now being sold person to person. And yeah, it is a big problem. While there are a lot of people who take too much of the benzodiazepines, they're not as likely to kill you in a matter of a few minutes, even from an overdose. And so there hasn't been as much push for having an antidote like this available in the hands of patients and loved ones and community organizations. But there is a lot out there, and there are, unfortunately, there's sometimes 2 or 3 different people prescribing benzodiazepines for the same person.
Just I want to add a comment while staying on the same topic, as Dr. Mitchell very explained about the nasal spray very in detail. I just want to add on one thing on that. Per my experience, whenever we are giving it in nostril, I hope nobody has to use it to their beloved ones, but in case if you have to, be cautious when you are giving it. Make it sure that you push it good, like in a 1, because it has to come out as a spurt. If it doesn't, then you are going to lose the medicine. So if you are just doing it slowly, then it is just coming like in a drops, and it will be coming out of the person. But if you push it hard, then it will come out as a spurt, and that will be much more effective. The person will get the whole dose. And about this intramuscular, it is also the same thing, and particularly in a nasal spray. The other one, I hope, is a little bit by parts. Administration, that's a little hard for the people to do at home. But in an acute care setting, obviously, we just go ahead and most of the time we do the IVs. And it is, as Pedro was asking, that it is, you can go ahead and you can use it 2 to 3 minutes, as Dr. Mitchell mentioned, and you can go for a multiple doses. Hopefully, you have already triggered 911 and it is coming in time. And but by giving after injecting, make sure that you continue if patient need the CPR as well. That is pretty much crucial. Then again give it, and then again continue the CPR as long as if you are in the field and you are waiting for the 911 to come. Sometimes that can be very, very life-saving. Thank you.
Dr. Mitchell and Dr. Khan, we're used to being here in the Riverside metropolitan area. But if I was a little bit further out or halfway up the mountain, if I gave 1 dose of Narcan and the patient revived, woke up, was talking to me, but EMS has not shown up in 30, 40 minutes, and the patient starts to fall unconscious again, can I go ahead and then give the 2nd dose at that point?
Absolutely. Absolutely. You have to keep on going and making sure the patient is awake and airways are clear, patient is breathing, yes, that will be very, very crucial. And sometimes, as with the overdose, patient will become hypotensive as well. So that's the reason sometimes it is advised that you continue to do the sternal rub. If patient is breathing fine, but you are thinking that he's pale and he's that, so giving a sternal rub, what does that mean? Is trying to give him a pain, so his blood pressure can a little bit have a boost. So yes, you can do it, and you can do it up to multiple times. That is absolutely safe.
If the patient starts to fall unconscious again, go ahead and give another dose.
Yes.
And at that point, I would think I would call EMS back and let them know that I'd given a second dose.
Yes.
Okay.
Okay, any other questions, comments? Maybe some particular idea you have about Narcan that you want to dispel with the doctor, something you've heard that, you are not 100% sure about. Do you feel as a caregiver more confident about administering this life-saving medication? Anything goes. Let's take advantage of having the experts here.
Maybe you covered this already. I just wondered if you bought some to have on hand. Did you say it lasts for 2 or 3 years? Was that the expiration?
The expiration will be on there, just like the other products we typically get from the pharmacy, but on average, they usually last for 2 to 3 years.
Okay, thank you.
Coming from the family advocate perspective, a lot of times family members are not aware of what their loved one is taking. So is there a way that we can approach that so that we have a good idea if Narcan or naloxone would be a good option?
I'm sorry, can you repeat it one more time?
So maybe I can do, maybe you guys can hear me better than her audio. So the question was, families don't usually know what their loved one is taking. How do they know whether to administer, whether naloxone is the appropriate measure to take? Should they just give it and expect something to happen, or how do they know naloxone is the appropriate course of action to take?
Well, typical thing, I can take it. The typical thing is, again, we say is the history. History and some information. If you see at a surrounding, the way you went, and you see there is some meds are around there, or some family members say, oh, she takes this one or he takes this one. So yes, you have to guess it. But again, as I know Dr. Weigold and Dr. Mitchell has mentioned, that the side effects are very, very minute, but the benefits are much higher versus risks. So it is very safe that if you think that, yes, it may be an opiate overdose, as Dr. Weigold and Dr. Mitchell mentioned in their presentations, that it can be, like the first slide on Dr. Mitchell's presentation was, that person can look like that unconscious, this. And now to go in a detail, it can be due to so many multiple reasons. Patient may be in a, if we know patient is diabetic, patient is maybe in a diabetic coma, or ABCYZ. If patient is with the heart failure, that may be pale and this, or hypotensive and lost consciousness. Our patient got a syncopal attack or seizure attack. So certainly naloxone, and as it has been said, that it is a life-saving drug, that even a layman person without any medical training or background, they can go ahead and safely, if they think that it can be the opiates, yes, because it won't be very, and side effects or anything will not be any risky. And it is other good thing is it's very short acting. I mean, and it will not stay in the system very long. And on the same note, as Dr. Weigold mentioned, that person, if you give a Narcan, maybe if he was doing it for the buzz, may get angry on us. That why you give a Narcan and took my buzz away. One other tip I want to give it for my experience, that whenever you are giving it, and after that, make sure that you put the patient on the side, on the lateral side. Why? Sometimes patient can vomit on you or something like that. That can be a little bit not a pleasant experience.
Right.
Okay. Any other questions? We're good. Any last words of advice from our presenters?
Get the Narcan.
Get the Narcan. That's right. No matter what it costs, it is even if it is a out-of-pocket expense, it's definitely worth the investment. You know, like we said, like mentioned by the experts here, life-saving drug, and you know, we all carry a spare tire in our cars. We all carry sometimes emergency kits. Hopefully, we won't need them, and it's just a matter of being prepared. It's better to have it and not need it than need it and not have it. Yeah.
So I have a question for the doctors here. So I work in the clinic in Corona Wellness and Recovery Center adult, and thank God, I never had the happening where I have to use the naloxone that I have. I have the nasal spray. So Dr. Weigel, I do not need a doctor's order, right, to give the medication, right?
I certainly would not think so. You know, from a sort of medical legal standpoint, I would not see this as any different than using a CPR pocket mask when you have to provide rescue breathing.
Thank you.
But Dr. Mitchell, for somebody working, a staff member in the clinic, is there any reason they would be required to get even a verbal order from a doctor to use Narcan in an emergency situation?
No, I don't think, as long as you're comfortable with the medication and you've been trained on its use, I think you're fine.
I know I'm not trained on that, but I mean, I'm trained on how to give medication, nasal medication, in the hospital. So I feel competent. But
every day, so you definitely are trained.
Thank you.
Right.
And
the pictures on the side of the box count as training.
Right.
Oh, okay.
Yes, exactly.
No, thank you. Because I was like, so how does one get trained on distributing? Okay.
Okay. Thank you so much, doctors and pharmacists.
Thank you.
Thank
Yeah. Okay.
I know that after this very thorough presentations from Dr. Weigold and Dr. Mitchell, there's not much to add on, but being internist and in a hospitalist, one thing I will just like to add to emphasize, just to emphasize on this point, that to get an Narcan thingy, it is just like if somebody has a heart problem in our family or anyone. So it is always good, as I think Dr. Mitchell mentioned or Dr. Weigold mentioned that to have aspirin at home or to have something in case or have a nitrostat or anything like nitroglycerin tablets that, hey, if you have a chest pain or something happens, so just put it under the tongue and this just to buy the time. So in that way, if some body is at home or beloved one or anybody is in pain pills, it is good to have a Narcan at a home because as I said, there's not much add to that thing, but just to re-emphasize of Dr. Weigold's presentation that it doesn't mean that how careful somebody is. Anybody can get overdosed due to some reason. Mistakenly, light went off, mistakenly took a tablet. I thought it is due to this. And particularly in acute care setting in the ER, we see it very oftenly. Like if we have on a call night, if we have a 30 admission on internal medicine service or 25, so it's easily like I can say still every day 2-3 patients end up to the ER. And obviously they get admitted. And very innocently they get overdosed. Some elderly, I was in a pain, I didn't want to wake up my daughter, she was tired, or my wife, I just took it and I just thought it was this, and maybe I took too many. He thought that he was taking blood pressure medicines, he took it pain. So it is very, I mean, by all means, it is advisable to have an Narcan and to making yourself comfortable. Even though these presentations are very, have done everything, but still if you have some concerns or you want to be, trust me, the YouTube is just, anybody can go to the YouTube. It is full of all the way all you have to do is just to press Narcan and they will give a very, very thorough how to lay down, how to presentation, how the beloved ones, they have done it. So I hope if somebody have a family members and they have a concerns or they don't feel comfortable, please make yourself comfortable by watching those YouTubes, 2-minute, 3 minutes thingy. It's full of it. Thank you.
The gods of Google just came through for me, and I was finally able to find data on how many people have an allergy to naloxone. It is less than 1 in 10,000 who have even a minor allergy to naloxone.
Good news. Thank you.
Great.
Anything else?
Okay. You guys are good? Wow, the presentation was so well covered that you left them speechless. No, it was very well covered. It was very well covered. And if there's any other questions, I don't know, I heard somebody.
I can't turn on my video because something's going on, but I just want to say thank you. The presentation is really, really good. This is news to me, and I'm very thankful for this presentation. Thank you. My name is Marisol.
And I think that's the feeling that we all have. Brand new information. You know, certainly you hear so many things from the comadre or the neighbor or the person in the little league game, and you know, while watching your kids play, you hear so many things from different places. And sometimes that is incorrect information, or this happened, and we call it the chisme, you know, the gossip between the community, and it may be incorrect information. So hearing it from you guys really I hope that it puts all our families at ease, and it makes us more comfortable. Even those of us in the clinics, makes us more comfortable and more confident in what we're doing. Thank you. So any last minute questions? I don't want to take away from their evening. And yes,
Yes, I have a little bit of I don't know, could be a suggestion, but Dr. Weigel, could this presentation be available to us in the clinic? Or we have a number of clinics and the whole county. I don't know. Did you ever make it for the staff? That's the question.
I think we can definitely get somebody available, but Pedro is recording this one right here.
Oh, okay. That's true. Thank you.
yes.
We
So
can-
it's been recorded, and we will then edit and figure out what venue, whether YouTube, maybe the county website available for staff, maybe something through our inner office or interagency systems. We'll figure it out. A lot of this will be edited, but the presentation and the questions are valid. They need to be also added in there. But yes, we are looking forward to making it accessible to people who couldn't make it to the live presentation.
And Maria, now that you've asked for it, I'm going to raise my price for doing the presentation.
Right. And not just us as employees, but definitely the public. How do we make it accessible to the families that couldn't make it tonight, and for them to know? Dr. Khan did mention there's a lot of YouTube videos. Definitely want to add ourselves to the mix, and so.
Or even maybe just showing this presentation during a group or something at the clinic to our clients. That kind of stuff would be really good. So
there'll be some editing, and we'll
yes.
make it pretty and accessible, but that's the approach we want to take.
Perfect.
Yeah, maybe showing it on the TV in the lobby in between the movies.
You guys are going to become famous.
Exactly. So we can finally have something playing there and those nice TVs that we have in the lobby, in our lobby.
Right. Well, we definitely have ideas, and we have to troubleshoot where we go to next. We do want to reach the community, and definitely those that are partaking, or even like Dr. Michael said, the person taking painkillers, can benefit from this presentation. And so we'll make it accessible, we'll make it look pretty, and we'll move forward. If there's no other lingering questions, my mentor used to say, we can stay here all night, but we got things to do tomorrow. Miss Maria Garin, my mentor. And so that's how she used to send us away, because we could stay all night, really, literally. And so, but thank you for our presenters. Thank you very much. We'll do this justice, and we'll make it accessible to the communities and our families.
Okay. Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you.
Thank you, everyone.
Again, thank you, Dr. Weigold and Dr. Mitchell. Great presentation.